This slide talks about the effectiveness of aversion therapy in removing the habit of alcoholism. First, let's talk about what is aversion therapy. Aversion therapy is removing an unwanted behavior by associating it with an unwanted stimulus. Next, let's talk about the history of aversion therapy. The first ever experiment for aversion therapy was conducted back in the year of 1982. Back then, aversion therapy was conducted in two categories. One, the shock aversion therapy, and second, chemical aversion therapy. However, it is unethical to induce pain and illness on the participants. Thus, shock aversion therapy and chemical aversion therapy has since then been replaced with imagination. Based on the report written, I chose to talk about my second journal, which explains whether emetic or electric shock is a better aversive agent. The participants of the experiment were categorized into three groups. First, the control group. Second, the emetic aversion therapy group, where participants were given drugs as a form of treatment. And third, the electric shock aversion therapy group, where participants were exposed to electric shocks as a form of treatment. The participants were placed in the groups and determined by a sealed envelope. This eliminates any biasness from the researchers. The participants shared the same characteristics as being all males from the same medical center, with a mean age of 42.3. The experiment was conducted in a bar where participants were left alone and observed through a remote control camera. This allows the researchers to observe the behaviors of the participants in their natural settings. For the emetic therapy group, they are first injected with three drugs: pilocarpine, ephedrine, and ipecac. These three drugs reduce alcohol absorption to prevent shock. After the injection, participants are given 30 ml of their favorite drink, which they have ranked through a Likert scale before the experiment was conducted. This is to allow the participants to associate alcohol instead of the three drugs given previously to the illness that the drugs induce. After taking a mouthful of their favorite alcoholic drink, they are required to immediately spit it out. For the shock aversion therapy, participants are given 5 room temperature alcohols in the span of 10 sessions, where in each session they are given their favorite drink and 4 other alcoholic drinks. This is to allow them to have an aversion of alcohol and not specifically their favorite alcoholic drink. The participants in the shock aversion therapy group are required to lift the glass, drink a mouthful, and swish the alcoholic drink around their mouth. As the alcohol is in their mouth, the participants receive shock until the moment they spit the alcohol out. However, this experiment has a few restrictions. This experiment is done mid-morning. This is to remove any effects that their previous activities will cause. Participants are only allowed to drink water after midnight the day before the experiment is conducted. This is to reduce aspiration during emesis. For the emetic aversion therapy group, participants are only allowed to go to bed 4 hours after the experiment. 20 minutes after the experiment, the participants are given beer with potassium antimony tartrate. This is to prolong nausea, to allow the participants to associate the alcohol with the illness that they are feeling. A washcloth soaked in alcoholic drinks is placed next to the head of the participants as they sleep. This is to strengthen the aversion of alcohol. The results taken are categorized into a few parts, such as skin conductance to alcohol, which the emetic therapy group shows an increment. Next, for the heart rate responses, the emetic therapy group shows an increment as well. For the mean number of sips, it increases for the emetic therapy group more than it does for the short aversion therapy group. The conclusion from the experiment is emetic produces a more effective aversion compared to shock therapy. However, there are some limitations to the experiment, such as shocking the participants is an unethical move. To prevent for further studies, instead of continuously shocking the participants throughout the experiment, the researchers should alternate the unpleasant stimulus, such as giving other unpleasant stimulus such as pinching. The participants in this experiment also does not represent the population, as the participants are only males and taken from the same medical center. This means that they grew up in the same environment and host the same characteristics. To solve this limitation, for future experiments should be repeated in a different environment, where both female and male genders should be taken. Or the results and claims of the experiment should be supported by another experiment. The reason why I chose my second journal to talk about is because the researchers controls most of the variables. The experiment is conducted in a bar with the participants left alone. This allows them to act in a natural setting. The participants are also allocated into the group by random allocation. This removes any biasness towards the categorizing of the results. The journal also takes into account both methods, which is the chemical aversion therapy and the emetic aversion therapy. The results were also taken with many methods, such as heart rate, numbers of sips, and skin conductance, which will strengthen the claim of the results. Thank you.